Welcome back to my channel, and in today's video we have a very important topic, a very peculiar and unique joint in human body, that is the temporomandibular joint. And you know that this is the site of your both temporomandibular joints, and it helps you to open your mouth, chew your food, even bite a chicken leg, and much more. Do you know how many temporomandibular joints we have? Of course, you will say 2, but I tell you we have 4. Yes, we have 4 temporomandibular joints functionally, and we are going to explore it. At the end of this session, you will get the answers to that. This is a 4-session module. The first one discusses about the anatomy and the temporomandibular joint capsule, and specifically the temporomandibular joint disc. The second one focuses on the capsule and ligaments of the temporomandibular joint along with its muscles. The third one discusses about the function, the kinetics and kinematics of the temporomandibular joint. And the fourth one discusses about the pathomechanics and some conditions like dentition, etc. in the temporomandibular joint. And this is the first session on this series. And here we discuss about the anatomy of the temporomandibular joint, and more specifically we focus on the temporomandibular joint disc. If you wish to know anything in particular, the time codes are given in the description. Kindly check on to that. And here we discuss the temporomandibular joint. We are going to discuss the temporomandibular joint. I told you the temporomandibular joint is a unique joint in the human body, right? Yes, it is a unique joint in the human body. And of course, you have 2 temporomandibular joints, and sometimes functionally you tell it as 4 temporomandibular joints, TMJs. Yes, okay. And the other peculiarities of the temporomandibular joint is that this is highly related to the cervical spine. Why it is important? Cervical spine, it has complex function, and it requires continuous and throughout range motion. Continuous motion is required in most instances, and especially if you're someone who speaks a lot, this is going to work even much more, right? And it is an incongruent joint, okay, and it is an incongruent joint. These are the few things that you need to remember about the temporomandibular joint in particular. And what is the temporomandibular joint? The temporomandibular joint is formed between the temporal bone and the mandible. So to understand that, you need to understand few important structures in the skull. That is, this is your temporal bone. You can see this one. This is the temporal bone. To here, this is the temporal bone. Okay. This is a sphenoid bone. You have here your sphenoid bone, and this is the zygomatic bone. This one. This is the maxilla. And once again, this is the temporal bone, which is expanding from here to like this, okay? And this is your sphenoid bone, and this is your zygomatic bone, and this one is your maxilla, okay? And finally, the most important one, the mandible. So these bones, along with another bone, hyoid bone, these bones are the ones that are closely related to the temporomandibular joint. Which one are that? The temporal bone, the zygomatic bone, the sphenoid bone, the maxilla, the mandible, and sometimes the hyoid bone, okay? But our point of interest is onto the temporomandibular joint in particular, and there we divide it into 2. That is the proximal articular surface, as always, and the distal articular surface. Proximal and distal. Can you predict which one is the proximal articular surface? The upper articular surface. Come on. Yes, very good. That is a temporal bone. Yes, that is a temporal bone. The proximal articular surface is your temporal bone. Very good. Which structure in the temporal bone? More correctly, the mandibular fossa in the temporal bone. The mandibular fossa in temporal bone. The mandibular fossa in the temporal bone. Let me explain to you. No need to worry about that, okay? This is your temporal bone, as I told you, okay? And here you have the mandibular fossa. This one is the mandibular fossa. This fossa, this cavity is the external auditory meatus. Don't confuse with that. And in front of that, Here you have the mandibular fossa. See, my fingers goes inside that. This is the mandibular fossa, a concave shaped mandibular fossa, right? And it is extending between this structure. This is the articular eminence, which is that articular eminence. And this bone or this expansion over here is known as the postglenoid tubercle. Postglenoid tubercle. So this is the mandibular fossa. This is the mandibular fossa in the temporal bone. Okay, and this is where your temporomandibular joint is going to articulate. Both sides you have the same mandibular fossa. Right? Let us just go through that. So this is a mandibular fossa in the temporal bone, and mandibular fossa expands between postglenoid tubercle and articular eminence and articular eminence. Yes, I would like to point you that this temporomandibular joint or the mandibular fossa is actually a very not this one, the mandibular fossa is actually very thin and translucent. Very thin and translucent. So what happens when the mandibular fossa is very thin and translucent? This do not have the quality to become a proper articular surface for the mandibular condyles, right? And thus functionally not the mandibular fossa but the articular eminence in front of it serves as the articular surface. Is it clear? The mandibular fossa is anatomically the articular surface, but we see that this is thin, translucent and not efficient as an articular surface. Here you cannot see it as a translucent. If you take the temporal bone alone, it is a translucent one too, and more than that it is thin. Okay, so this articular surface, articular eminence which is seen over here is exactly behaving as your articular surface. So more clearly you can tell temporomandibular joint's proximal articular surface is the mandibular fossa along with or plus the articular eminence. The mandibular fossa along with the articular eminence. This is the proximal articular surface of the temporomandibular joint. All right? Yes, very good. And you see that the condyles of the mandible, this one, okay, which we will discuss now, is convex shaped. You can see this one. And your articular eminence is also convex shaped. That makes the joint incongruent. The first point that we discussed, the joint is incongruent, right? Yes. And that's all about the proximal articular surface. I would like to summarize again. It is formed by the temporal bone, that to the mandibular fossa. But we saw it is actually formed between the mandibular fossa and the articular eminence. And mandibular fossa expands between the postglenoid tubercle and the articular eminence, right? That's all about the proximal articular surface. And now our discussion moves on to the distal articular surface. What is that? The distal articular surface. Okay, what is the distal articular surface in our TMG? Which is very simple. That is your mandible. That is your mandible. This is the largest bone of your face. The mandible is the largest bone of your face, and it is a horseshoe shaped structure. You can see that it is a horseshoe shaped structure. If I want to discuss about the mandible, entire topic we would have discussed, but this is not the right time. We will just focus on what is important with regard to the temporomandibular joint. Yes, the mandible has a condyles. This is known as the mandibular condyle. This is known as the mandibular condyles. Okay, this mandibular condyles is the thing that articulates in the temporomandibular joint. This mandibular condyles is the one that articulates in the temporomandibular joint with the mandibular fossa. See this one? This is the articulation. Not this. This is the coronoid process of the mandible. This is not going to articulate, but this mandibular condyles are the one that is going to articulate and form your temporomandibular joint. So the distal articular surface is the mandibular condyle. Of course, the condyle has a head. This region is known as head, and a constricted region known as the neck. The condyles has a head and neck. More importantly, you see this one. In this posterior view, you can see that this is slightly expanded this direction, this is slightly expanded this direction. That is, it is having a medial pole which is in the midline, which is to the midline, that is a medial pole and a lateral pole. So the mandibular condyles has a medial pole and a lateral pole. Very good. Yes. So these are the peculiarities of the mandibular surface. The condyles of the mandible articulates with the mandibular fossa or the articular eminence, whatever it is. The condyles are 2 in number, that is both sides you have the mandibular condyles. And the mandibular condyles has a medial pole and a lateral pole. The lateral pole is this one, is quite palpable, and you can palpate your lateral condyle. Yes, all of you can try it out. This is your lateral condyle. Yes, and of course you can even palpate the posterior part of this mandibular condyles. Just put your finger bed in the external auditory meatus, slightly anterior and inferior. Place it over there and just open your mouth, protrude and retract your mandible. Here you can feel this one very clearly. You can feel the movement of the mandibular condyles. That's just for the fun. Yes, and these are the peculiarities of the mandible. It's the largest bone in the face, right? It is having 2 condyles known as the mandibular condyles, and it is having a coronoid process. This region is known as the mandibular notch. This is known as the mandibular notch, and that is having a medial pole and a lateral pole. And the posterior part is palpable, lateral pole is also very palpable. The mandibular fossa, mandibular condyle, sits on the mandibular fossa in the temporal bone and makes the temporomandibular joint. Temporomandibular joint. The mandible is quite different in shape from a different individual. For example, the condyles can be in this shape, but you have a condyle over here, you can see the shape is changing. The condyles is convex over here, but here it is a flattened one. See, that's a difference in different mandibles among the individuals. That's just for your information. And now that is all about the distal articular surface, which is your temporomandibular joints. Distal articular surface is your mandibular fossa condyle. Mandibular condyles are seen 2 in number, and they are seen associated with the mandible, and in front of that you have the coronoid process, which is a site of attachment your temporalis muscle, right? Mandibular condyle has a medial and lateral pole. The lateral pole and posterior aspect is a palpable one. Very good. Mandibular condyle sits in the mandibular fossa. Some general facts about the temporomandibular joint. So we discussed about the articular surface. We were discussing about the articular surface, and we had the proximal articular surface we discussed, the distal articular surface we discussed. In together, the temporomandibular joint is what type of joint, you know? It's a condyloid. It is a condyloid, you know, it's a condyloid joint or a hinge joint. Hinge, synovial joint. Synovial joint. But we see that this is not a typical synovial joint. A typical synovial joint always has hyaline cartilage coverage. But this joint do not have a hyaline cartilage coverage, but it is a fibrocartilage coverage. See, it's a fibrocartilage that is covering over here. That is, it is an atypical synovial joint. It is an atypical synovial joint. Why? That is because it is having a fibrocartilage instead of hyaline cartilage. And why in particular fibrocartilage? It is because you know that the temporomandibular joint is highly susceptible to large amount of biting force, often about 600 to 1000 and 1200 Newton, sometimes 1200 Newton, such large amount of biting force. And thus there can be a chance of a lot of compressive forces in that region, and your fibrocartilage is capable of withstanding it more, and fibrocartilage is capable of remodeling it. The fibrocartilage is capable of remodeling it. Fibrocartilage is capable of withstanding more amount of compressive force. And thus this fibrocartilage over here can remodel when there is an excessive loading. The loading involves this one. This movement can be a loading movement, and this can induce the remodeling of the fibrocartilage, which is not seen in the hyaline cartilage. Right? So this joint has a fibrocartilage, which is a peculiarity of this temporomandibular joint. Very good. With this, we wind up our discussion on the anatomy of the temporomandibular joint. In particular, remember, it is in the mandibular fossa in the temporal bone. The mandibular condyles are the one articulating. But functionally, we see the articular eminence is very important in the articulation. Right. Now, this is time to discuss something more important as far as your syllabus or as far as our knowledge is considered. That is the accessory joint structure. Accessory structures in temporomandibular joint. Accessory structure in temporomandibular joint, and that is your temporomandibular joint disc. That is the joint disc in temporomandibular. Why I wrote it so big? That's because it's quite important, and it's quite very important as far as knowledge and as far as the clinical conditions are considered. What is temporomandibular joint disc? Let us see what is temporomandibular joint disc. And for that we need a diagram. Let us draw a diagram like this. Yes, very good. Yes, very good, like this. This is your mandibular fossa. This one is the mandibular fossa, and this is your articular eminence, and this is your articular eminence, and this is the post-glenoid tubercle, and you know that the mandibular fossa stretches out between the structures, and you have your mandibular, let us draw it here, you have your mandibular condyle. Okay, you have your mandibular condyle. More correctly, if you draw the neck, it's a constricted portion. Let's draw it like that itself. Yes, neck, it's a constricted portion. You have the mandibular condyle like this. Yes, okay, the mandibular condyle, more correctly like this. Yes, and now you see these structures, okay, this one and this one is a convex. So that is producing some problem. It is making the joint incongruent, and you need something that can increase the congruence, and that is your disc. That is your disc. Actually, the disc, it runs from here like this. It runs from here like this. This is your disc. This is your articular disc in the temporomandibular bone. Yes, that is your articular disc in the temporomandibular bone, right? Make it like this, okay? And for saving the time, we make it like this. This is your disc. Actually, you can see this one, this red colored thing that I labeled over here is your articular disc, the articular disc of temporomandibular joint. And you can see it is lining between the mandibular fossa and the condyles of the mandible. And this disc makes or divides the joint into two different joints. That is, this one is the inferior temporomandibular joint, right? And this one is the superior joint, okay? This one is the superior joint. So this is in the right side or left side. Similar to that, you have in the right side also. So totally two in the left and 2 in the right. That makes the total number as 4, which I told you earlier, right? Yes, the temporomandibular disc divides the joint cavity into two portions, a superior temporomandibular joint and an inferior temporomandibular joint. I hope it is clear. Yes, it's quite simple. Okay, now what is the peculiarity of the disc? Okay, let us imagine the peculiarity of the disc. The disc is anteriorly attached. You can see this one. This is the anterior attachment of the disc, and that muscle is known as the pterygoid muscle. Pterygoid muscle, the lateral pterygoid muscle. So the disc is attached anteriorly to the lateral pterygoid muscle. What is its function? Can you imagine? Can you guess? Of course, you can see that it prevents the posterior translation. It prevents the posterior translation of the disc. So the lateral pterygoid muscle is seen anteriorly attached to the disc, and this anterior attachment prevents the posterior translation of the temporomandibular joint, right? Yes, very good. And posteriorly, you see the temporomandibular joint is attached, or the disc is attached to a peculiar structure. that is this structure. This structure over here is known as the retrodiscal pad. Retrodiscal pad. That is, what is such structure? That is known as the retrodiscal pad. And that is having a superior lamina. This is the superior lamina. This is the superior lamina. And this is the inferior lamina. The retrodiscal pad is a structure which is seen attached posteriorly to the temporomandibular joint disc or the articular disc. And it is having a superior lamina and an inferior lamina. Clear? It is having a superior lamina and inferior lamina. And this superior lamina is quite important to us. The superior lamina is quite important to us because that superior lamina is elastic in nature. That superior lamina is elastic in nature. So when your temporomandibular joint condyle, which is this one shown by my hand, when it moves like this, when it moves through during the jaw movement, what is happening? This elastic one will move. This elastic one will give away, and that will provide the movement. But it has elasticity, so after the movement it will regain back. It will take the temporomandibular condyle back, mandibular condyle back. Clear? Can I explain it once again? Yes, that is the superior lamina of the temporomandibular joint. That is the superior lamina of the temporomandibular joint is actually elastic in nature, and that helps in the forward movement, the translatory movement. Okay, but when the movement is over, this elasticity provides back or holds back the temporomandibular joint condyle back into its normal position, right? Yes, very good. And the inferior lamina is not having an elastic property. The inferior lamina is not having any elastic property. It is just attached to the neck of the temporomandibular joint condyles. Okay, it is attached to the neck of the temporomandibular joint. This inferior lamina, can you guess any function? This lamina will prevent the anterior translation. So this one will prevent the anterior translation of this disc. But it is not elastic, so it will not provide the coming back. The coming back is provided by your superior lamina itself. So let us summarize it. The disc is anteriorly attached to the lateral pterygoid muscle. The anterior attachment of the disc prevents the posterior translation. The disc is posteriorly attached to the retrodiscal fat pads, and it is having two lamina, bilaminar. So this retrodiscal fat pad is known as bilaminar retrodiscal fat pad. That is the superior lamina and the inferior lamina. The superior lamina of the retrodiscal fat pad is elastic in nature and help in the forward movement. And it is elastic, so it pulls back also. Yes, and the inferior lamina is not elastic. It is attached to the neck of the temporomandibular joint condyle, but it also helps in preventing the anterior translation of the temporomandibular joint. These are the peculiarity of the temporomandibular joint disc. Now let us see what are the functions of the temporomandibular joint disc. What are the functions served by temporomandibular joint disc? The functions of temporomandibular joint disc. It is a simple thing, you can guess it. I think you can tell me what are the functions. It increases the congruency. Very good. It increases the congruency. Yes. Second one, it increases the stability. Very good. It smoothens the movements. Very good. It smoothens the movements or eases the movements. And you know, it is a disc. So bone-to-bone contact is not there. Therefore, reduce friction. Reduce friction. And also reduce biomechanical stress. Biomechanical stress. Very good. Very good. So let us see the functions. That is, it increases the congruence. It increases the stability. When congruence is increased, stability increases automatically. Yes, and it smoothens the movements of the temporomandibular joint. It reduces the friction, and finally, it reduces the biomechanical stress inside the temporomandibular joint. You must always remember that disc is quite important because it divides the joint cavity into two spaces. And you see an important function of the temporomandibular joint disc are this one. Along with that, this disc is actually moving at the time of your forward movement. For example, if this is the temporomandibular joint and you have here your disc, this jaw moves anteriorly. Okay, let us examine with this one. The jaw moves anteriorly. When the jaw is moving anteriorly for this movement, the anterior translation, what is happening? The articulation is actually changing. The temporomandibular joint condyles is moving posteriorly. So it comes in contact with the articular disc, with the articular eminence. This is convex, this is convex. If both of this comes in contact, what can happen? It can cause problem. So the disc actually translates. The disc actually move from here to here. Okay, disc actually move from here to here. So reduce when this condyles are reaching here, the disc will be already over that place and will reduce the pain or friction in that joint. Sometimes what happens is that the disc will come forward, but it will fail to go backwards. That is, the disc will not have its normal function. And what can happen at that time? You can see that at here, the retrodiscal fat pads. Okay, these are the structures. These structures will reach at this place. And finally, what can happen when this joint is in resting position? It can cause severe pain. So that is one of the pathologies seen with the temporomandibular joint. Just look at it in the following. Here we can see the temporomandibular joint disc, that is the articular disc, which is shown in the pink color, and its attachment also is shown in the diagram. See the movement, the forward translatory movement, and what is happening to the disc. It is actually moving into the articular eminence and thus preventing any friction or pain between that structures. And this is attachments are shown, the lateral pterygoid, and posteriorly you can see the retrodiscal fat pads. And you must remember that the disc at the center is avascular, and this condition is known as the disc displacement that we were discussing. And in this condition you can see that the contact area has been moved from the disc into the retrodiscal fat pad structures, and that structures are highly vascular, and that makes a high excessive pain to that joint, right? And before summarizing our discussion, we see some common features of the temporomandibular joint disc. Okay, that is, first one, it is the biconcave in shape. That is, it is biconcave in shape. You can see this disc, it is having a shape like this. The disc is having a shape like this. That is, the disc is something like a biconcave in shape. Here it is actually a thin region, very thin region, and both ends are expanded. This is the anterior end, this is the posterior end, and this is the middle disc. Or this is the anterior disc, this is the middle disc, and posterior disc. This is often having a millimeter of 2 millimeter thickness. The posterior is larger, 3 millimeter thickness, and center is very small, 1 millimeter, and that is why it has a biconcave structure, because you know that the articular eminence is convex, this also is convex, so you should have a biconcave structure. And this biconcave structure is more clearly seen in this one, where the anterior disc or disc can be divided into 3 portions: anterior disc, middle disc, and posterior disc. Anterior disc is 2 millimeter in size, middle disc is 1 millimeter, and posterior disc is 3 millimeter in size. All right, very good. And we saw the functions of the temporomandibular disc also. Yes, and the temporomandibular disc is made up of many components like proteoglycan, okay, the collagen, very good, and elastin. The collagen is capable of providing the shape to the temporomandibular joint disc. The shape of the temporomandibular joint is maintained by the collagen. Elastin we already studied, it gives an elastic property, and proteoglycan gives the mechanical properties to the temporomandibular disc. So the composition of the temporomandibular disc is, it is made up of proteoglycans, it's made up of collagen, it's made up of elastin, and various other components. And more specifically, collagen gives the shape to the temporomandibular disc. That is, it's a biconcave shape, and the elastin gives its elastic properties, and proteoglycan gives its biomechanical or mechanical properties. Right? Yes, very good. And the temporomandibular joint disc is having vascularity over here, vascularity over here, but it's a central portion. This central portion is actually avascular. That is because the peripheries are vascular and the central portion is avascular. And you know that the central portion is actually not having is having only a function of being weight bearing or acting as a weight bearing structure. And of course, that's why maybe it is having avascularity. That's just to add on to the temporomandibular joint disc is having both ends of the disc as vascular and center of the disc is avascular in shape. And with that, we wind up our discussion on the module 1 of the temporomandibular joint, where we discussed about the anatomy and the temporomandibular joint disc. In the upcoming video, we have the ligaments and the muscles of the temporomandibular disc, and later the functions and biomechanics and pathomechanics. I hope you enjoyed the video. If you liked the video, please don't forget to click the like button, and don't forget to subscribe to our channel so that you are aware with all the latest updates in our channel.